Hi friends, I am going to tell you something about what we call as liver resections, or in a very simple term, liver surgery. I need to just briefly tell you, when do we do liver surgery or why do we do liver surgery? Well, some 20 years back, this was not a very known entity, but of late, with advancement in so many things in technology and skills and everything, liver surgery has become a reality, which actually is a very, very complex kind of operation or surgery. Liver resections are basically done for all those liver lesions which are cancerous or malignant, and some variety of tumors which are also non-cancerous. The cancerous variety, they form the major bulk of the liver surgery work, and therefore actually I am going to try and tell you something about liver surgery for liver tumors, and most of them, like I told you, they are malignant. Liver surgery for non-malignant tumors is not really required because of the obvious reason. But in some situations, even non-cancerous tumors may need an operation. Essentially, liver is divided into two halves, the right side and the left side. And therefore, if a liver tumor or a liver lesion, I would call it simply, is on the right side of the liver, then by an operation, we remove the right side of the liver. And it is called as the right hepatectomy. Now, if the lesion or the tumor is on the left side, then we try and remove the left part of the liver, and it is also called as left hepatectomy. To go into slightly more complexities, the entire liver is divided into 8 segments, and sometimes there may be a small lesion or a tumor in one of the segment. And if I try and remove only that segment of the liver, then it is also called as segmentectomy. Another form of liver resection or liver surgery is that a particular tumor may be lying in one segment and another segment, or half of it here and half of it there, wherein we try and remove the tumor by a procedure which is called as non-anatomical wedge resection, wherein we are not really specifically removing a particular segment, but we are trying to take a part of one and other segment both. So basically, liver surgery entails removal of the diseased part of the liver or the liver tumor, including with a rim of normal tissue, so that if it's a cancerous tumor that we have removed, it should not start spreading in the remnant liver. It may sound very easy to listen to, but there are a lot of permutations and combinations and a lot of preparation which goes in a liver surgery, and that actually is the more essential part, as in how do we choose the patient for liver surgery, what is his general level of fitness, is the patient really in a position to take a longer operation, or is he feasibly or fit enough only to take a short operation. All these things have to be considered, and they are done through a scrupulous pre-operative checkup, and after he or she undergoes fitness from our physicians, cardiologists and anesthesiologists. The second part of the story is the surgery actual, and the third most important part is the intensive care which these patients require. As you all know, liver does more than 100-200 known and unknown functions in the body, and when I am trying to take off a chunk of that tissue, all the metabolism, what we call in the body, is going to get affected. So a good team of anesthetists and intensive care people, they make sure that all these activities are restored as quickly as possible, or they normalize gradually, so that the patient does not have major or minor complications. The important risk factor in liver surgery is obviously, which is well known, is uncontrolled bleeding, which can happen in any known and unknown situation. Despite best of the efforts, there can be more bleeding, and therefore all the parameters are stabilized in such a way that the bleeding is less or minimum, and all the operation theatre setup, the doctor team are actually geared for this. The second big problem is that after we remove a part of liver, the remnant liver may go in a kind of a shock and may not function for a while, which is also called as liver failure. Now all these things need to be assessed, and therefore I was stressing that a pre-operative checkup is one of the most important things in liver surgery. The other complications include small jaundice, which can happen because of the sheer liver trauma, infections, even renal failures can be precipitated, and therefore all the liver surgery patients need to be properly examined and selected for liver surgery. Liver surgeries are done by conventional operation. Smaller liver resections or interventions are now even being done by laparoscopic surgery, and slowly the role of laparoscopic surgery may grow. To conclude, liver surgery is a complex procedure not to be done by inexperienced hands, but at the same time, if done carefully in well-equipped center in an experienced doctor team setup, the results are fabulous. If you want to know more about all this thing, kindly go on to my website, that is www.drchetanmahajan.com. Thank you very much.